We've reported several times on the looming crisis of dementia and how we're not prepared to cope with a number of people who will have it. But that warning is about seniors. There's another side to dementia that doesn't get as much attention: early onset of the disease. 1 in 1,000 Canadians will develop early onset dementia, sometimes in their 30s or 40s. Shirlee Engel has the story of one couple struggling with the diagnosis and realizing how little support they have.
It's no longer the girl that I married, and that's the evil part of this disease.
In less than a year, Matt Dineen watched his wife of 15 years, Lisa, dedicated mother of 3, deteriorate to the point that she had to go into long-term care.
Either she was going to be, we would have to take her out of the back of a police car or an ambulance, and so luckily we didn't. She's somewhere safe now.
Another Canadian family shattered by dementia. But what makes the Dineen story especially heartbreaking, at 44 years old, Lisa and Matt are in the prime of their lives.
Never in my wildest dreams could I have imagined what took place. You know, it's memories that I'd like to erase, but they're part of the journey.
That journey took Matt to Parliament Hill today, where he's determined to change the face of dementia from the old and frail to the young and vibrant. An NDP MP whose own family has been touched by this awful disease urged the government to support a private member's bill for a national dementia strategy.
We need research, early diagnosis, and prevention, training of professionals, help for caregivers.
Health Minister Rona Ambrose will attend a special G8 Dementia Summit in the UK tomorrow. And critics say Canada is the only G8 country without a nationwide plan to deal with an expected dementia epidemic as our population ages.
This is really a national emergency. There's no time for us to debate this anymore. We have to take action.
The parliamentary secretary wouldn't commit to a national strategy.
We believe in real steps, in actually funding research and actually funding the families that are currently suffering.
Since the vast majority of dementia patients are seniors, Matt wants to make sure young families like his are not overlooked.
I know if Lisa was in Australia right now that she would be in a long-term care facilities with others of a similar age and demographic.
And he's urging others not to ignore the warning signs. Shirlee Engel, Global News, Ottawa.